I'm Mary Mittelman, and I have been doing research to help family members of people with dementia for the past 30 years. We began with a randomized control trial of a psychosocial intervention that was individually tailored to the needs of each caregiver and family and person with dementia. And we ran a study that was funded by the National Institutes of Health in the United States for more than 20 years. And because we had funding for that length of time, we were able to demonstrate both short and long-term outcomes of the NYU caregiver intervention. The positive outcomes of the intervention included fewer symptoms of depression, less stress, better physical health, and because of the caregiver's well-being being improved, the caregivers were able to keep the person with dementia at home with them for an average of 1.5 years longer than those who got the usual care at our Alzheimer's disease center. And the mechanism by which all of the other outcomes were achieved, the depression, stress, physical health, was through improved satisfaction with social support of the family caregiver, who in the initial study was a spouse or partner, from their family and friends. So all of the other outcomes that we observed were due to improved social support. And that's really the theme of all the interventions that we have researched. More recently, we've been developing and testing interventions for caregivers with a person with dementia. And they've included a couples counseling intervention that had demonstrable improvements, that led to demonstrable improvements in the relationship between the members of the couple. We evaluated the Meet Me at MoMA program, which is an arts program that includes people with dementia and their family members, and demonstrated major impact on both. And then in 2011, I founded a chorus for people with dementia with their family members. And the only eligibility criterion for joining is that the caregiver has to agree to attend all of the rehearsals and the concerts that follow. And that original chorus has now been rehearsing and providing concerts for the enjoyment of other family members and the community at large since 2011, and they've had more than 20 concerts now, and they're now rehearsing for their 21st concert 5 years later. The chorus calls themselves the Unforgettables. They learn 18 new songs. The people with dementia learn new songs as well as the caregivers. Some of them have discovered that they are good soloists that never sang before, and the caregivers have formed relationships with each other that have lasted all these years, and that they continue even after the person with dementia dies or enters into a nursing home.